Good day everyone. I'm Dr. Tengku Ahmad Hidayat, consultant physician and clinical hematologist from Beacon Hospital, here today to share a little about lymphoma. Lymphoma is a cancer of the lymph node gland in which mutation of the lymphoid cells causes an overgrowth of the lymph gland with the disruption of the structure and function of the lymph node. Basically, when a person has lymphoma, lymphocytes divide at an abnormal rate and do not die when they should. There are two main types of lymphoma, Hodgkin and non-Hodgkin. Hodgkin lymphoma and non-Hodgkin involve different types of lymphoid cells. Every type of lymphoma grows at a different rate and responds differently to treatment. The symptoms of both Hodgkin and non-Hodgkin lymphomas are painless swollen lymph node in the neck, under the arms or in the groin, fever, night sweats, extreme fatigue, unexplained weight loss, difficulty getting over a common cold or an infection, anemia, itching with or without a rash. Many of these symptoms can also be warning signs of other illnesses. Consult a doctor to find out for sure if you have lymphoma. In most cases, the exact cause of lymphoma is unknown, but several factors may increase the risk of developing the disease, such as gender, increasing age, family history of lymphoma, compromised immune system, Epstein-Barr virus infection, exposure to chemicals, exposure to radiation, HIV, HTLV, HH8 virus infection. Diagnosis usually begins with a physical examination with the doctor checking for swollen lymph nodes and organs throughout the body to look for general signs of the disease. Usually the diagnosis includes blood tests, biopsy, CT scan, PET scan or MRI scan. The treatment you get depends on what types of lymphoma you have and its stage. The main treatments for Hodgkin lymphoma and non-Hodgkin lymphoma are chemotherapy, which uses drugs to kill cancer cells, targeted therapy that targets aspects of lymphoma cells to curb their growth, immunotherapy, which uses your body's immune system to attack cancer cells. If these treatments didn't work in certain clinical scenario, patient might need to have a stem cell transplant, also known as bone marrow transplant. Radiotherapy is also another option to treat certain lymphoma, which uses high energy rays to destroy cancer cells. In Beacon Hospital, we are consisting of multidisciplinary team of health professionals who are specialists in their respective fields. Each of us aims to offer you the best treatment that has the best chance of successfully treating your lymphoma with the long-term effects on your health. We consider individual and other numerous factors when deciding on the best treatments for you, such as the type of lymphoma you have, the stage of your disease, how fast your lymphoma is growing, the size of lymphoma, what parts of your body are affected by lymphoma, your symptoms, the results of genetic tests on your lymphoma, which can tell your prognosis. And individual factors involve how old you are, your general health, and other medical conditions you have, any other medications that you are on, any other factors that are important to you. Led by a team of 9 resident oncologists, hematologists, multidisciplinary surgeons as well as allied health staff, we strive to improve the quality of life for our patients at every phase of the disease, from early detection, diagnosis, treatment to supportive care. Beacon cares for you. Your health is our priority.